Erectile dysfunction is more than just a physical issue. The impact goes beyond the bedroom, affecting relationships, mental health, self-confidence, and overall quality of life. Erectile dysfunction, formerly known as impotence, is the inability of a male to achieve and maintain erection sufficient for sexual intercourse. There are other penile disorders, but with erectile dysfunction, it affects the ability to achieve and to maintain a firm erection enough for sexual intercourse. This is different from premature ejaculation, which is a condition in which the entire process of arousal, erection, ejaculation, and climax occurs very rapidly, leaving the partner unsatisfied. Erection is a complex neurovascular process which involves the central nervous system, the peripheral nervous system, vascular, hormonal factors, local and psychological factors. So a disruption or imbalance in any of these can result in an erectile dysfunction. This is the most common sex-related condition that males report to healthcare providers, especially as they age and develop other health issues. Erectile dysfunction can be a sign of an underlying health condition, most especially a heart disease. It is age-dependent and the incidence increases after the age of 40 years. 52% of men aged 40 to 70 years show some degree of erectile difficulty. Those numbers may be higher as many don't seek help due to embarrassment or shame. Having trouble getting an erection once in a while is common, as this is affected by how you feel, whether relaxed or stressed, nervous or anxious, and also is affected by alcohol consumption and substance abuse. So now, on to the types of erectile dysfunction. Basically, there are 4 of them. First is the vascular erectile dysfunction. Here, the blood vessels that send blood to the penile tissues are affected, or the venous valves there are compromised, and this is the commonest type of erectile dysfunction. Secondly is the neurogenic erectile dysfunction, which occurs as a result of nerve problems, which prevents signals from traveling from the brain down to the penis to produce an erection. Thirdly is the hormonal erectile dysfunction. This is due to hormonal problems such as testosterone deficiency or thyroid hormone dysfunction. And lastly is the psychogenic erectile dysfunction, which arises from conditions that affect an individual's feelings, such as stress and anxiety. People at risk of erectile dysfunction are usually men 40 years or older, men who are diabetic, people with BMI over 25 or are obese, individuals with heart conditions, people who are depressed, physically inactive individuals, or those that smoke cigarettes or abuse substance. There are a variety of things or conditions that can cause erectile dysfunction, and primarily is vascular compromise. And if you remember, we said that the vascular erectile dysfunction is the commonest type of erectile dysfunction. This vascular compromise can arise from conditions such as atherosclerosis, heart attacks, high blood pressure, peripheral vascular disease, medications such as antidepressants, antipsychotics, antihypertensives. Also, systemic diseases such as hypertension, diabetes, BPH, liver cirrhosis, renal failure, nervous system disorders such as epilepsy, stroke, Alzheimer's disease, Parkinson's disease, endocrine conditions such as hyper or hypothyroidism, hypogonadism, penile conditions such as priapism, and mental conditions such as depression, performance anxiety, or widower's syndrome. Also, we have blood diseases such as leukemias and sickle cell anemia. Symptoms present as loss of early morning erection, lack of interest in sex, trouble getting an erection, and also trouble sustaining an erection. To make a diagnosis, a medical history is taken and physical examination done alongside other investigations such as full blood count, a lipid profile, liver function test, thyroid function test, urinalysis, penile Doppler ultrasound scan, magnetic resonance angiogram, penile biothiometry. Check the blood glucose level, the prostate-specific antigen levels, and also hormonal assay to check the testosterone level, luteinizing hormone, and prolactin hormone levels. Once the underlying cause has been identified, it is treated accordingly. First is sexual counseling. Seeing a sex therapist is very important. Also, drugs can be used, oral medications such as PDE5 inhibitors. Example is sildenafil citrate, popularly known as Viagra. Intraurethral suppository, penile injection of vasoactive medications. There is also the penile low-intensity focused shock wave therapy, which improves blood flow by using sound waves. Testosterone replacement therapy, penile prosthetic implants, if all other therapies fail. With all this being said, if you are dealing with erectile dysfunction, you are not alone on this journey. And with the right support, treatment, and mindset, it is possible to overcome erectile dysfunction and regain your confidence.